Dr. Joel Lessan is a trained pediatric surgeon who does surgery for the children and also trains other pediatric surgeons. My practice, I work in Nairobi, but the Kenyatta National Hospital, where I do the incubation, that's the training of other pediatric surgeons. And outside of Kenyatta Hospital, I run a private practice, which is actually based here in Gertrude Children's Hospital. Apart from being in the teaching sessions and in the private practice, we also reach out to the community. I reach out to the community in two ways. One, going out to get those kids who require surgical intervention and cannot afford, and then bringing them to the mainstream and finding out an opportunity for them to be operated. And I actually go on to operate for free. Then periodically, once in a year, I do outreach campaigns where we look for all those kids who require surgical intervention, and we find a place where we can intervene and give them the surgical services that they require. So pediatric surgery starts from very early age. That's around the time when the kids are born. There are those who are born with abnormalities which have to be corrected surgically, and that is neonatal surgery. So that's the first phase of the surgery itself. We do correcting defects in which the child are born with. If there is a incomplete development of any certain areas of the child, we move in, we find out what it is, and we do correction for that. Then in the later ages of the kids, when they grow up, they could have injuries, for example. We attend to that. They could have conditions that develop as you grow up, like cancers in children. We also come in and attend to that. Then later on in life, there are those developmental things now which present later on in life, late childhood and early teens. Those are the ones we also attend to. In between, the other cases which would probably be required by the society, some surgical procedures, maybe circumcisions, maybe removal of extra things here and there, or insertion of maybe implants onto the kids. We do that kind of things here. When it comes to training, we train at a higher level, that is postgraduate students, the ones who are specifically preparing to be pediatric surgeons. So they usually have to be postgraduate students who have to report either through the University of Nairobi, or they come in through maybe other hospitals where they're doing fellowships. So, and in terms of training, it's not just where we train on terms of principles, but it's a practical arena where we have to go to the operating room with the students and develop them from basic until they're able to do complex surgeries.